Good evening. My name is Sandra Valtero and I'm your host this evening. Tonight I am very happy to say that we are going to be talking about a very important subject, vaccines and the importance of it and how we can be prepared. So tonight I have two of our top epidemiologists from the state of Massachusetts with us, and actually they were here before talking about infectious diseases, and I'm happy that they came back. So let me introduce you again. Beside me is Dr. E.Craven, who is an infectious disease of medicine in Burlington at the Leahy Hospital Medical Center and at the Tufts Medical Center. He specializes in infections that are difficult to diagnose or unresponsive to treatments, such as HIV or airborne infections from a foreign country. The International Association of Healthcare Professionals has welcomed Dr. E.Craven to their prestigious organization with his upcoming publication in the leading physicians of the world. Dr. E.Craven has been in practice for more than 4 decades and is currently serving as chairman of the Center for Infectious Disease and Prevention for the Leahy Hospital and Medical Center in Burlington. In addition to his clinical work, Dr. E.Craven serves as professor of medicine at the Tufts University Medical Center and Tufts University School of Medicine. He is board certified in infectious diseases by the American Board of Internal Medicine and maintains a professional membership with the Infectious Disease Society of America. And for his hard work and dedication, Dr. E.Craven received the Kenneth Kaplan Award for Excellences in the practice and teaching of infectious diseases from the Massachusetts Infectious Disease Society. Welcome, Doctor.
Thank you.
That's quite a list.
Thank you
And
very
next
much.
to him is Dr. Dee Maria, who is a medical director of the Bureau of Infectious Diseases and Laboratory Sciences in Massachusetts at the Department of Public Health, and he's the state epidemiologist for Massachusetts. He has been involved in applied epidemiology of public health surveillance and public health practice for over 26 years. He is a graduate of Boston University and Harvard Medical School, and he is trained in internal medicine at Montefiore Medical Center in the Bronx, New York, and in infectious diseases at the Boston City Hospital. Prior to joining the Department of Public Health, he was in private practice and prior to that on the staff of the Maxwell Finland Laboratory for Infectious Diseases at the Boston City Hospital. He is a fellow of the Infectious Disease Society of America and the Society for Healthcare Epidemiology of America. He is a past president of the Council of State and Territorial Epidemiologists and Northeast branch of the American Society for Microbiology. He serves as a member of the advisor on several committees of the Massachusetts Medical Society, and he is also on the board of Public Health Museums. Well, welcome, gentlemen.
Thank you.
I'm proud to have you guys with us. Let's start off talking about why vaccines are important. Which one of you would like to start?
Well, I think that people don't realize the full value of vaccines because they don't see the consequences of not having vaccines. For example, polio. Many people remember polio. Some people have had family members who had polio. Some people, though, people born later, really haven't dealt with polio and seen the consequences of polio, so they don't really fully appreciate how valuable that vaccine has been and the tremendous impact that it's had, because polio was actually increasing in the 20th century. So we sort of think that with improved sanitation, things get better and there should be less disease in general, but actually polio is getting worse because polio virus is around, and before there was good sanitation, kids were exposed to the polio virus while they still had their mother's antibodies from the placenta and from at birth, and so they couldn't get the paralytic disease because they were protected with antibodies. And so actually polio was increasing into the 1950s, and if that had continued as it was going with the continued increase in the human population in the United States, we would be seeing over 100 cases of paralytic polio every single day in the United States. That's the impact it had in the 1950s, and it doesn't have that impact now because of vaccine. And because of that vaccine, there's only 2 countries in the world where polio is still being transmitted.
Wow. Would you like to add anything more to that,
Well, I
Doctor?
would second Dr. Dee Maria's comments. I grew up during the polio epidemic in the 1950s. I had a sister that was in the hospital for 6 months with polio and many friends that lived on the same block, so that when the vaccine came out, there was like a tremendous sigh of relief that the chance of getting polio went to essentially zero. So it was a tremendous vaccine. It was highly effective, and it completely changed the lives of hundreds and hundreds of people that were exposed, or potentially could have been exposed to the virus.
Yeah.
And as Al pointed out, it's been great because it's been used around the world, except for 2 countries that has refused to use the vaccine, where there still are high numbers of polio cases. So it's a success story that we can be proud of in this country.
So most people complain they have to have their children vaccinated. So why do we have school-based vaccine programs and schedules?
Well, you know, basically we think every child should be vaccinated. In fact, everybody should get all the recommended vaccines. And that's because the consequences of not getting the vaccines are significant illness and life-threatening diseases. And again, people don't see them, so they don't really appreciate how terrible the consequences are of not getting vaccinated. And why we require children to get vaccines before going to school is that we don't want them to bring those illnesses, those infections, to the school setting, because there are children in the schools who can't be vaccinated because they have immune problems or for some other reason they don't have a good reaction to the vaccine, a response to the vaccine, immune response, so that they're at risk of getting these infectious diseases. And the more kids that are not vaccinated, the more the risk for the transmission of these infections. So back in 1855, Massachusetts required smallpox vaccine. Was the only vaccine available at the time for entry, and ever since then, this is a proven way of protecting the population from these terrible diseases. And some people think there are too many vaccines, but in point of fact, we don't have enough vaccine because there are still diseases that could potentially be preventable that we can't effectively prevent because we don't have a vaccine for them.
Right. Well, some people need many vaccines at a young age, and is that true? There are certain ones that don't.
And there are, all of these vaccines are proven. In fact, the recommendations that the CDC and other professional organizations put together, all of these vaccines have been studied very carefully. These recommendations are based on science, the best possible evidence to prevent disease, and that's why we're so gung-ho about getting kids vaccinated, because the consequences are dire. Up until recently, measles was one of the top 5 causes of death in children under 5 in the world, and now that's starting to be pushed back because of the efficacy of measles vaccination.
Wow, that's wonderful. So how much do vaccines contribute to health and life expectancy, Dr. Craven?
Oh, I think it's extremely, it's a high proportion of people that are going to live long lives as long as they get vaccinated. That you can start with, as Al pointed out, children, because children can contract these viruses. So if we can protect children and then older adults so that they can't spread the virus elsewhere, we're going to have a lot more success than trying to chase after people that could develop the diseases and spread it to other people rather than try to control them. So the vaccines, we're very lucky. We live in a country where the vaccines are readily available, and in many places there are schools that actually mandate that the children have vaccinations before they can be admitted or stay in the school so that they don't spread to other people.
So what vaccines are recommended, and when are they recommended?
Well, you know, that would take sort of the
long
rest of the show. But people should go on the CDC website and look at the recommendations. The pediatricians are very tuned into these recommendations. They have supported these recommendations, as have the OBGYNs and the internal medicine specialists. And again, all of these vaccines have been studied in detail. They're recommended because they work and they prevent disease and death, and because they also save healthcare costs. So all of these things have to be true before they're recommended. And again, parents may feel that, you know, there's a large number of vaccines that their children are getting, but those are vaccines for diseases that before these vaccines were available would maim and kill children. And there's no better way of preventing these diseases than the vaccines. And again, I wish we had more vaccines, because there are not vaccines for some diseases that are still injuring children.
Absolutely, yeah. So as you started to say, they are cost benefits for having vaccines, for the state as well as for the person themselves, right? So why are some people hesitant about vaccines?
Well, I think they hear things, and they hear things or they see things on the internet. And once that's in your mind, it's hard not to worry about these alleged problems with vaccines. And so whenever people start getting concerned about that, we have to look into it and see if there's any reasonable concern expressed. And that takes a lot of time, it takes a lot of work. So in the meantime, parents are nervous, parents are worried. And we've seen this over and over again over the last 40 years. A vaccine has been implicated in some problem that's related directly to the vaccine, and then there is studied and it's disproven that there's any association. People tend to see associations because the child gets a shot and then something happens after that is not, the cause and effect may not be there. There may be other causes, and people jump to the vaccine, and then the vaccine gets disparaged in people's minds, and people don't want to don't want their children to get it, and then the children are at risk for these horrible diseases. And that's what we've seen, for example, when pertussis vaccine was implicated in neurological diseases. There were studies involving hundreds of thousands of children that disproved this connection. And what was happening is children were getting whooping cough and were getting critically ill and sometimes mortally ill from the disease that could have been prevented.
Wow, that's a shame. So where can we get accurate information about vaccines?
Well, I think there's several places. One is the Centers for Disease Control. They have a tremendous amount of information that's available on the website for any kind of questions you wanted to ask, what the disease was, what the consequences of the vaccine is, so that the CDC is sort of like the main satellite for all this information to be put through. At the same time, the state, Massachusetts, has a tremendous public health department that is very, very active in getting information out on vaccines, making sure that individuals are vaccinated and that they have up to date, or if a new vaccine becomes available, that they are able to take that information, tell doctors locally that this new vaccine will help prevent them from getting a serious disease. The most recent one is a disease that prevents meningococcal meningitis. A bacteria that gets in can go to the brain, cause meningitis, can cause death, or what we call meningococcemia. It can be lethal, and basically this new vaccine, which was another component of the meningitis vaccine, meningococcus group B, is now available. There was an outbreak at Princeton University last year where the vaccine had to be flown in from Canada because it wasn't approved in the US, but now it is approved and available for people at risk.
Wow, thank goodness for that, huh? So do vaccines have side effects?
Of course, everything has side effects.
Yeah.
And there was an interesting thing on the radio today about a professor who talked about, I think he called it hydrogen dioxide, and basically it was water, and he was talking about how dangerous water was until he explained that it was water, and the kids in the class wanted to ban it because it sounded so dangerous, but it was water. So everything has a potential, and we take that very seriously. We don't downplay the problems, but the problems, the value is so much, the benefit is so much better than any concern about the problems, because, and that's been shown time after time after time. And people, people get, hear stories. Again, some of these stories are inaccurate. Occasionally there are severe reactions because you have allergic reaction to almost anything. But the consequences of these diseases, these have been studied in that respect. The consequences of the diseases are overwhelmingly worse than anything that could possibly be related to the vaccine. For example, flu vaccine. People say, concerned about flu vaccine. When you actually look at the potential side effects of flu vaccine, they're less than almost every over-the-counter medication that people just take without thinking. So I think people really have to put this into context. They have to ask the questions, get the accurate information, and make decisions on the basis of the science. And I would say the science overwhelmingly
Right.
recommends the recommended vaccines.
Well, a lot of people believe that, well, sometimes someone will come down with some kind of a virus after having the shot, right? And is that not because they were coming down with a cold or something beforehand, and that's why?
There was
they
a great
have
study where they looked at flu vaccine, and they gave 400 healthy workers flu vaccine and 400 healthy workers
Placebo.
normal saline, just salt water. And they didn't know what they were giving, people didn't know what they were getting. And they called them a week later and said, what happened after the vaccine? And 35% of the people who got the vaccine said, I had the flu after the vaccine. And 35% of the people who got the normal saline, the placebo, the no vaccine, said, we got the flu. So whatever was causing that illness that they were experiencing had nothing to do with the vaccine.
Yeah.
That was it's a
That's
good example.
interesting, yeah. What about the live vaccine versus the one that's not alive? We were using the live vaccine at one time, and
Yeah, we're not
not doing that anymore.
Not because it was dangerous or anything, but because it wasn't as effective as the injectable vaccine.
oh, really?
And there's a lot of children who are very disappointed about that, but that's the way it is.
So are they still doing the nasal ones?
Not so much,
Not
no.
so much,
It's
yeah.
still available, but we're not recommending it till we know more about how effective it is.
Yeah, okay. So how costly is it for the government to provide vaccines for us?
I don't think really cost should be an issue. We really are looking to really have people have a healthy life where they don't have to worry about getting diseases like meningococcemia or any of the diseases that we vaccinate against. So that I think when you look at risk benefit, it far outweighs the costs of the vaccines and what might happen. And there are adverse events that people have, but they're usually minor, they're not serious. And that basically we have to maintain the vaccine program to again prevent outbreaks or the spread of the disease to innocent people that haven't gotten the vaccine.
Yeah. So they're not worried about the costs, you're saying?
And
Right.
we've made the case, in Massachusetts, the state pays for all the childhood vaccines, whether or not the child has insurance. So, and we do that because it's not only cost effective. Cost effective means that for every dollar spent, you get a certain advantage. They return on the investment. So for every dollar spent on vaccine, you get multiple dollars worth of decreased healthcare costs, decreased out of work costs, and a variety of other things. So they're really cost beneficial.
That's,
Yeah, particularly for some of these severe diseases, like you can't take a chance on the more severe diseases. If you don't really vaccinate and protect, it's a hospitalization, it's spreading to other people that are potentially at risk. And so that putting it together, the most important thing is that we maintain the health of everyone's health. And a lot of times you can't look at someone and know exactly what they have. They have symptoms, but you don't know exactly which disease they have. So that vaccines really are the foundation for which we build protection against disease.
Yeah, sounds like it. Now, do most insurances cover vaccines?
Well, under the Affordable Care Act, the recommended vaccines by the Preventive Services Task Force and the Advisory Committee on Immunization Practices have to be covered. Now, sometimes if you go to the pharmacy, your insurance will cover it, but you have to get reimbursed. And sometimes the pharmacist can directly bill your insurance company. But the recommended vaccines should be covered by your insurance, and we've made some progress in Medicare in terms of better coverage of pneumonia vaccine, for example. And so that should not really be a concern for people. They should struck it over with their healthcare provider, as many times that's the best place to get your shots. But even now you can go into a pharmacy and get the recommended vaccines as well.
Yeah, and even if you don't have insurance, they can.
Well, if you don't have insurance, the Massachusetts there's no good reason for not having insurance, although there are some people who are not included in our in our programs. So what they should do is call the health department, call their local health department. Often the local health department can figure out a way of getting people the vaccines that they need, especially in the foreign-born populations. If people have immigrant status, they're not necessarily covered by insurance, although there are ways of getting coverage too. Nobody should go without a vaccine because they can't pay.
Right. And so where are the places they can go to get vaccine? Let's say besides their family doctor. You mentioned a drugstore.
CVS has
CVS.
a lot of these CVS stores have
Most of them.
vaccine clinics that they have that are available for the public at
Yes.
low cost.
Do public health nurses give out vaccines
Yeah,
too?
the local health departments often have vaccine clinics. People can go to community health centers for their care because they're very tuned into preventive care. So there's a lot of options, and if people don't know what the options are, they should call the health department because we can at least sort of point them to the places that they can get vaccine.
So if a person is traveling out of the country, let's say going to Africa or in India, where do they go to get protection to go to these countries?
There are travel clinics. Most of the hospitals in Boston, most of the teaching hospitals and many of the other hospitals have a travel clinic where basically wherever you're going, they look exactly what types of vaccines are needed to make sure that they have coverage and to minimize their risk of acquiring an infectious disease while they're abroad.
Yeah.
You know,
Some of them are scary. Is it like the yellow fever and all the side effects they warn you about before you take it?
Yeah, but
it's probably better than
they're
yellow
scary.
fever.
yeah, it's a lot better than yellow
Yellow
fever.
fever.
Yeah.
That,
I know.
plus, I think people get used now to a variety of medications being advertised on television and the whole laundry list of potential. Those are real, but they're usually very rare, or sometimes they're even hypothetical possible complications. So I think people have to sort of accept the fact that the recommended vaccines are highly effective and highly safe, and the consequences of not getting them are worse than the consequences of getting the vaccine. Any consequence could possibly happen with the vaccine. I get every single vaccine that's recommended,
Do you?
sometimes even before I'm supposed to get them.
Oh.
We need more vaccines. Like we have a
Yeah.
Zika problem that's emanating in
Yeah.
Florida and some of the other states around, so that a virus, having Zika virus and having a vaccine that could prevent that would change it not only for the United States but for other countries in the Caribbean where the disease is widespread and growing.
If we had an effective Ebola vaccine, we wouldn't have to go through what we went through a couple of years ago.
I know. It's really dangerous. People who travel on flights, I mean, it's just recirculated air. I mean,
Yeah, that's why,
there's,
if you get all the recommended vaccines, you reduce your risk of being affected by those exposures. You can't avoid the exposures, but you can prevent the disease with a vaccine.
But
people.
you raise a good point, though. There is very good evidence of transmission of diseases on airplanes where there's a person coughing, sneezing,
Yeah.
and basically can transmit an infection to other people that are innocent people just riding along in the plane. So
You
important.
recommend people get on an airplane and wear a mask? Would that
well, if they're
protect them?
coughing or sneezing, they should, because
Yeah.
there's an aerosol that goes
Yeah.
out
they're
in the
sick,
plane,
yeah.
and so you have to
Absolutely.
minimize transmission that way.
Well, okay. So any last comments before we end about the importance of vaccines?
I would
I
say
think-
again, people should go to the CDC website.
Yeah.
Look at the vaccines. There's a lot of information, why they're recommended. People can dig into this further. And if they have any questions, they should talk to their physician, their nurse, people who are knowledgeable about vaccines, and not just, accept anything they might come across on the internet.
Right. And I think some people are concerned if they have a lot of allergies and someone says, well, we want you to take this vaccine. Are doctors readily, willing to tell them about all the side effects and to see if that person still wants to take it? Do they have a choice sometimes?
Well, there's always a choice, and that's why,
Right.
they should talk to their provider.
Yeah, because it can be very dangerous, I guess, for someone with allergies if they don't
Not
know.
necessarily, no. There are allergies and there are allergies, and I've never actually seen an allergic reaction from a vaccine that got to the stage like a
Really?
nut allergy in a kid. Yeah, no,
Well, that's
it's
good.
manageable.
Good, excellent. Well, thank you so much. I'm looking forward to you guys coming back next month and finish this topic, because it's a lot to cover, and it's a lot of good information, because we want our public to be prepared, you know, for any of these diseases that are coming around now. There's a lot of new ones, as we'll talk about next time when we meet. And thank you so much for being here. So this is Be Prepared, and tonight we talked about vaccine and how important it is. And so hopefully you will all take heart in everything we said here tonight and be prepared for yourselves and your families to get out there and get these vaccines that are recommended. And again, thank you very much for joining us, and we'll see you next month.